करने वाले हैं फार्माकोलॉजी फर्स्ट के एमसीक्यू के बारे में, जो कि फोर्थ सेम के लिए है और ये ज्यादा इंपॉर्टेंट है ऑनलाइन बेस्ड जो एग्जाम हो रहे हैं उसके लिए। ठीक है, चलिए हम स्टार्ट करते हैं। फर्स्ट क्वेश्चन नंबर, फार्माकोकाइनेटिक्स इज द स्टडी ऑफ एब्जॉर्प्शन, डिस्ट्रीब्यूशन, देन मेटाबॉलिज्म एंड एक्सक्रीशन। एक्सक्रीशन लास्ट में होता है। अगर आप कोई भी ड्रग खाते हैं तो सबसे पहले आपका जो ड्रग का जो क्या होता है, क्या करता है, एब्जॉर्ब करता है आपके बॉडी में। फिर वो ड्रग क्या करता है, डिस्ट्रीब्यूट करता है, पूरे बॉडी में डिस्ट्रीब्यूट करता है। फिर इसके बाद मेटाबोलाइज करता है, देन इसके बाद एक्सक्रिएशन का काम करता है लास्ट में। ठीक है, देन अब सेकंड क्वेश्चन नंबर देखते हैं। द मेन मैकेनिज्म ऑफ मोस्ट ड्रग एब्जॉर्प्शन इन जीआई ट्रैक्ट। द आंसर इज पैसिव डिफ्यूजन। हम इसको क्या बोल सकते हैं, लिपिड डिफ्यूजन भी। द आंसर इज डी। Okay, next is 3 question number. A hydrophilic medicinal agent has a flowing property, low ability to penetrate through the cell membrane, lipid. The answer is A. Okay, next is 4 question number. What does the term of bioavailability means? A fraction of an uncharged drug reaching the systematic circulation flowing any route of administration. सिस्टमेटिक सर्कुलेशन उसे कहते हैं जो पूरे बॉडी में जो सर्कुलेशन का काम किसका है, ब्लड का है। तो पूरे हर जगह पे वेन जो है वो लगे हुए हैं, तो उस वो क्या है, सिस्टमेटिक सर्कुलेशन का काम करता है, पूरा ब्लड को फ्लो करवाता है। तो वो क्या होगा, सिस्टमेटिक सर्कुलेशन। ठीक है, बायोबिलिटी सबसे ज्यादा किस में होता है, सिस्टमेटिक सर्कुलेशन में। ठीक है, तो नेक्स्ट क्वेश्चन नंबर हम देखते हैं 5 क्वेश्चन नंबर। विच route the drug administration is most likely to lead to the first pass effect? The answer is B, oral. Okay, पहले जो है वो ओरल से अगर ले रहे हैं तो फर्स्ट पास इफेक्ट दिखाएगा कहां से, ओरल से। ठीक है, द नेक्स्ट इज 6 question number. 6 question number is parenteral administration is usually produce a more rapid response than the oral administration. अगर आप मेडिसिन खाते होंगे तो तुरंत इफेक्ट नहीं करता है। जैसे कि आप मेडिसिन खाएं तो मतलब जैसे ही खाने के बाद तुरंत इफेक्ट नहीं करेगा, कुछ देर के बाद करेगा, 20 मिनट के बाद करेगा, आधे घंटे के बाद करेगा, 1 घंटे के बाद करेगा। लेकिन अगर वही चीज हम डायरेक्ट इंजेक्ट करते हैं अपने पेनेट्रल के थ्रू, तो वो बहुत जल्दी रैपिड रिस्पॉन्स देता है। ठीक है, क्योंकि वो डायरेक्ट ब्लड में हम इंजेक्ट कर रहे हैं। ठीक है, अब नेक्स्ट क्वेश्चन नंबर देखते हैं 7। फार्माकोडायनेमिक इन्वॉल्व द स्टडी ऑफ फॉलोइंग एक्सेप्ट। The answer is absorption and distribution of drug. The answer is B. Okay. Next is, what does affinity means? What does affinity means? A measure of how tightly a drug bind to receptor. The answer is B. Okay. Next is 9 question number. An agonist is substance that interact with the receptor and initiate change in the cell function, producing various effects. The answer is B. Okay, next is 10 question number. An antagonist is a substance that, the answer is, bind to the receptor without directly altering their function. The answer is D. Okay, next is 11 question number. A competitive antagonist is a substance that, the answer is, bind to the same receptor site and progressively inhibit the agonist response. The answer is B. Okay, next is 12 question number. Take the substance which change the activity of an effector element but does not belongs to second messenger. The answer is C, G protein. Okay, next is 13 question number. Give the definition of therapeutical dose. कुछ definition dose जो है वो the amount of a substance to produce the required effect in the most patients. The answer is C. Okay, ये therapeutical dose का क्या है, definition है। Okay, next question number देखें 14 question number. Pick out the correct definition of toxic dose. Toxic dose होता है उसका correct definition क्या होता है, the amount of substance to produce effect hazardous for an organism. The answer is B. Okay, next is 15 question number. What term is used to describe a decrease in responsiveness to a drug which develops in the few minutes? The answer is D. Tachyphylaxis. Next question number is 16 question number. Drug resistance is a term used to describe the loss of effectiveness of an antimicrobial or anti-tumor drug. This consideration is, the answer is true. The answer is A, true. Okay. Next is 17 question number. What phenomenon can occur in case of using a combination of drug? Is the answer is D, Sanerism. The answer is D. Okay. Next is 18 question number. A teratogenic action is negative action on the fetus causing fetal malformation. The answer is B. Okay. Next is 19 question number. Therapeutic index is, therapeutic index को हम short form में क्या बोलते हैं? TI. The answer is A. A ratio is used to evaluate the safety and usefulness of a drug for the indication. The answer is A. Okay. Next is 20 question number. The type of antagonism are competitive type. किस type का है? Competitive type का. The answer is D. Okay. Next is 21 question number. Half-life is the time required to change the amount of drug in plasma by half duration elimination. The answer is A. Okay. Next is 22 question number. Pharmacodynamic involves the study of flowing. The answer is mechanism of action. The answer is A. Mechanism of action. Next is 23 question number. The substance binding to one receptor subtype as an agonist and to another as an antagonist is called. The answer is agonist antagonist. Agonist antagonist. The answer is C. Okay. Next is 24 question number. What phenomenon can occur in case of using a combination of drug? The answer is D. Sanerism. The answer is D. The next question number is 25 question number. Irreversible interaction of an antagonist with a receptor is due to. The answer is covalent bond. The answer is C. Covalent bond. Next question number. Tick the feature of the sublingual route is pretty fast absorption. The answer is A. Pretty fast absorption. Next is 27 question number. Parenteral administration जो होता है usually the produce more rapid response than oral administration. ये हम आपको बता चुके हैं. The next question number is 28 question number. Biological barrier includes all except. The answer is A. Renal tubules. The answer is A. Renal tubules. Next is 29 question number. Which route of drug administration is most likely to lead to the first pass effect? The answer is B. Oral. Okay. Next is 30 question number. Pick out the appropriate alimentary route of administration when passes of drug through liver is minimized. The answer is C. Rectal. The answer is C. Rectal. Okay. Next is 31 question number. General unwanted effect of vasoconstrictor is. The answer is C. Decrease of peripheral blood flow. The answer is C. Okay. Next is 32 question number. Take the drug influencing the blood flow which is related to antiplatelets agents. The answer is B. Aspirin. The answer is B. Aspirin. Next is 33 question number. Migraine is a disorder connected with dysfunction of regulation of cerebral vessel tonus. The answer is C. Okay. Next is 34 question number. A good local anesthetic agent should not cause C. The answer is C. Fast onset and long duration of action. The answer is C. Okay. Next is 35 question number. Which of the following opioid analgesic is a strong mu receptor agonist? The answer is B. Morphine. The answer is B. Morphine. Okay. Next is 36 question number. Which of the following opioid analgesic can produce dysphoria, anxiety, and hallucination? The answer is C. Pentajocin. Pentajocin. The answer is C. Okay. Question number. Neuroleptic are used to treat. The answer is B. Psychosis. The answer is B. Psychosis. The next question number is 38 question number. Most antipsychotic drug, the answer is strongly block post synaptic D2 receptor. Strongly block post synaptic D2 receptor. The answer is A. Okay. Next is 39 question number. Which of the following antipsychotic drug is typically? The answer is haloperidol. The answer is C. Haloperidol. Okay. Next is 40 question number. Tolerance means Sansakti and drug resistance can be consequence of increased metabolic degradation. The answer is B. Increased metabolic degradation. Next is 41 question number. Which of the following drug is related to anticoagulant and may be useful in disorder of cerebral circulation? The answer is D. Heparin. The answer is D. Heparin. Next is 42 question number. All of the following statements regarding the diuretic are true except the answer is carbonic anhydrase inhibition led to increased reabsorption of NaHCO3. The answer is A. Okay. Next is 43 question number. The drug acts by competitively blocking the Na plus K plus 2Cl minus transporter. The answer is A. Loop diuretic. The answer is A. Loop diuretic. Next is 44 question number. The drug acts in the distal convoluted tubules. The answer is B. Thiazide diuretics. The answer is B. Thiazide diuretics. Next is 45 question number. The drug is one of the most potent diuretics. The answer is B. Furosemide यानी कि लैसिक्स. लैसिक्स जो है वो इसमें काम आता है अगर आपको टॉयलेट अगर नहीं हो रहा है, रुक गया है, तो उसमें लैसिक्स काम आते हैं. टैबलेट भी आते हैं और इंजेक्शन भी आते हैं, उसमें आपको काम आते हैं लैसिक्स, जिसको कि फ्यूरोसेमाइड ये कंपोजिशन है. नेक्स्ट इज 46 क्वेश्चन नंबर. Select the endocrine drug which is a peptide derivative. The answer is oxytocin. The answer is A. Oxytocin. Next is 47 question number. Which of the following hormones is produced by the anterior lobe of the pituitary? The answer is C. Growth hormone. उसको इसी को क्या बोलते हैं? Somatotropin GH. The answer is C. Okay. Next is 48 question number. Which of the following glucocorticoid is a long-acting drug? The answer is dexamethasone. The answer is B. Dexamethasone. Next is 49 question number. Indication of vasopressin are flowing. The answer is C. Pituitary diabetic insipidus. The answer is C. Pituitary diabetes insipidus. The next is 50 question number. Vasopressin possesses the following. The answer is antidiuretic property. The answer is क्या? Antidiuretic property. Okay. Next is 51 question number. Vasopressin is caused pressure affected by. The answer is C. A direct action on smooth muscle of the blood vessel. The answer is C. Okay. Next is 52 question number. Which of the following statement about the calcitonin is true? The answer is D. All of the above. ऊपर के सभी. A is the calcitonin secreted by the parafollicular cell of the mammalian thyroid is a single chain peptide hormone with 32 amino acid. Then second is effects of calcitonin are to lower serum calcium and phosphate by the acting on the bone and kidney. Then C is calcitonin inhibits osteoclastic bone resorption. The answer is D. Okay, all of the above. Next is 53 question number, mechanism of the action of calcitonin. The answer is B, raises intracellular CMP is osteoclast. The answer is B. Okay. 54 question number, currently used oral hypoglycemic thiazolidines dions include the following except. The answer is troglitazone. इसको हम क्या बोल सकते हैं? Resolin. The answer is C. Okay. Next is 55 question number. All of the following statement concerning angiotensin converting the enzyme SE inhibitor are true except. The answer is they act by inhibiting the ability of renin to convert angiotensin tensinogen to an angiotensin. Okay, the answer is A. Okay, next is 56 question number. All of the following effect of SE inhibitor may be useful in treating heart failure except. The answer is B. They increase circulating catecholamine levels. The answer is B. Okay. Next is 57 question number. Which of the following statement about estrogen are true? The answer is D. All of the above. The first is estrogen are required for normal sexual maturation and growth of the female, and B is estrogen decrease the rate of reabsorption of bone, and C is estrogen enhance the coagulability of blood. The answer is D. All of the above. Next is 58 question number. The major synthetic estrogen are flowing except. The answer is estradiol. The answer is D. Estradiol. Next is 59 question number. Indication of synthetic estrogen are flowing except. The answer is D. For treatment of simple obesity. The answer is D. For treatment of simple obesity. Next is 60 question number. Vasopressin possesses the following. The answer is antidiuretic property. The answer is A. Antidiuretic property. ये जो है वो सेकेंड ईयर के लिए है, सब्जेक्ट जो है फार्माकोलॉजी 1 है, और ये सेमेस्टर जो होंगे इसका एमसीक्यू का वो 4 सेमेस्टर के लिए फार्माकोलॉजी 1, और इसका सब्जेक्ट कोड BP40T है, 404T। इसको आपको क्या करना है, प्लीज सब्सक्राइब जरूर करें, सब्सक्राइब करना ना भूलें, शेयर करना भी मत, कमेंट और लाइक जरूर कीजिए, और हमेशा खुश रहिए। तब तक के लिए बाय, नेक्स्ट वीडियो में मिलते हैं।